Welcome everybody to this discussion about a very, very interesting topic, something I've been pondering on for many, many years. And as you know, on our birth journey, we're not shy of going into areas that are perhaps a little bit controversial and difficult and bringing kind of our own assumptions to the fore so we can really look at them. And that's kind of what we're going to do today. And we've got with us Ian Rees, who's a psychotherapist, psychospiritual psychotherapist, and Sarah, who works with us, as you probably know, craniosacral in Cork in Ireland. And yes, I kind of wanted to discuss this because it's something I've seen in particularly in teaching circles. I think I first came across it in full force when I was listening to a very well-known pre and perinatal educator who'd written a few books. And I was at a meeting with him, and at the end, I went up to him. And in those days, I was sort of like slightly outraged and thinking, this needs to change. And so I was saying to him, why do babies have to go through all this pain? And he said to me absolutely categorically that, well, you have to understand, John, that they chose this. They chose to come in this way. And it kind of took me aback. And I really have kind of thought about that ever since. And so what we're going to do is look at our own assumptions as practitioners, and particularly how that influences our therapy work and our relationship with our clients, because it can be very, very varied, and people come. Parents will also come with their own belief system, which will also influence the therapeutic field as well. And people can have very, very strongly held beliefs about this. This is why it's difficult territory. I'm a friend of mine's daughter who is 16, who went through a lot of medical trauma and is quite autistic. But if anyone says to her, or if she sees any kind of YouTube videos saying that, children choose the way they're born, and she gets incredibly angry. I understand that. So we have to look at all perspectives. So, okay, so let's start off then, and let's perhaps we could look at how these concepts about that we choose our parents and we choose the way we are born. Where did they come from originally, Ian?
Okay, so let's where in the West at least, where this begins probably is round about the end of the 19th century, beginning of the 20th century, where a metaphysical movement arises that begins really with the spiritualist movement, and then becomes a variety of metaphysical movements, probably the most prominent of which is something called the Theosophical Society, and this was the very early stages of a kind of Western and Eastern tradition coming together. It was run by a woman called Helena Petrovna Blavatsky, wonderful name, who was a extraordinary half charlatan, half brilliant kind of teacher who brought what she believed to be a form of esoteric Tibetan Buddhism into the West, and the Theosophical Society just flowered all over the Western world, and right at the heart of it, ideas it took from Buddhism and from other places, and a sort of Hinduism. Was the idea of continual reincarnation, and the idea really of souls entering bodies. Now, out of that movement, and more specifically out of that movement, you get Rudolf Steiner appearing. Now, Steiner was originally a theosophist. But he is less interested in Buddhism and more interested in if you like, an esoteric form of Christianity called Rosicrucianism. And he developed his teachings based on what he called anthropophacy, which is the anthropomorphism, you could say, is the study of the wisdom of the human being. And from anthros meaning human, and Sophia meaning wisdom. And what you see, and right at the heart of a lot of his teachings was the idea of again the idea of reincarnation being a kind of something that happens to all of us, but linked with it the idea that there is a plan, an individualized kind of plan that a soul takes with it from life to life. Now, I mean, we could talk forever about this, but just to try and keep it contained, because that's kind of the larger kind of background. What happens in the early 60s, when, if you like, there's another movement around East-West that is, we're coming out of the war, we're coming out of the war years. There's immense curiosity about alternative ways of being. There's also the rise of the new psychologies, the beginnings of bodywork. Stanislav Grof is doing his thing. Frank Lake is, so we're getting the beginnings of the whole kind of the growth movement. You're getting the beginnings of encounter groups. You're also getting the development of hypnotherapy and regression therapy, and one of the kind of really kind of significant figures in a way is a man called Michael Newton, who was a Catholic psychologist who developed an idea he called life between lives, and life between lives regression therapy. So he again started. He was doing this in the 1960s, and he focused a lot of his work on the state between incarnations. And he wrote a book called The Journey of Souls, really, which which came out in the 90s, but it had been very active kind of before that in developing ideas that they would say something like, after a person dies, their soul leaves the body, goes into a spiritual realm, encounters guides and helpers, and then connects to soul groups. And the idea of soul group is that souls incarnate repeatedly with a sort of community of companions. And soul might be a parent in one life, might be a child in another, a spouse in a third, close friend in a fourth. And so he really started to put out the idea of this idea of souls collaborating together from a higher dimension, and creating sort of living plans that then the individuals incarnate into. And this sort of, we got to, the early 60s, it will be something that most people won't remember. I mean, I was only 5 in the beginning of the 60s myself, but I certainly remember the 70s and the sort of fusion of different ideas that was around there. In some ways, you can look at the development of the spiritual center Findhorn, which is probably one of the great center points of a lot of those different ideas. So you get a whole set of ideas. That's a new way of starting to look at the universe that has at its heart this idea that in between lives, there's a sort of kind of, if you like, a collaboration of souls. Then based on what's happened last time, make a decision. Okay, this is what we're going to do this time. And then the idea that that incarnation then is some planned events. Now this goes hand in hand really with the development of the beginnings of pre and perinatal work. Because we look Frank Lake, we look at Groff, we look at the beginnings, well, in a clinical sense, of people working not from the working from the body, working in the body, and recovering early memories. And um, and one of the things, the first is a lot of focus on birth trauma and both and birth experience, but that moves on to people like Thomas Verny into intra-womb experience, and then later the whole territory of conception and so it's almost like these streams kind of collide together and become one thing. So it isn't like there's a sort of orderly worked out plan. It's almost the amount of people, these things are active in the psychological and spiritual atmosphere, and and various people at various points feel it makes sense. The two ideas make sense, and so they become coupled together. They're not necessarily coupled together, I think, but in a sense they become coupled through history. And then in sort of growth circles, new age circles, they become sort of given ideas. You'll very often hear people talking about it and and in a way that's I think why it is so for us to kind of explore this, because these have become foundational ideas, whereas actually, yeah, but it's really important to understand they weren't ever worked out quite in that way. They were a function of a particular time when there was just an explosion of consciousness studies and psychological studies and the excitement of the new.
Mm.
And
And I
so
suppose in
yeah,
that Rudolf Steiner kind of put it into a bigger framework, didn't he? Which is still alive today, with the Camp Hill communities and
yeah.
Waldorf schools, and that it was kind of more formalized his idea about this, right?
Steiner, no, absolutely, Steiner was very much so. Steiner, a very powerful and interesting spiritual teacher in a way, but really had so Steiner has very clear ideas about this, and there's a whole, whole system in Steiner's thinking, and so and some Steiner's educational ideas, they say that when someone who's autistic or somebody who is disabled in some way, he would almost certainly say, "This is the will of their soul. Their soul has chosen this, and this is their perfect experience." And I think for me, one of the complicated things about Steiner generally, I've got great admiration to Steiner actually, but he has an awful lot of certainty in his writings. There's no sort of he really, when he's writing, clearly he was very sensitive, he was very connected to things, but his writings give us not a map in his. I mean, for me, they're a helpful kind of loose map that can illuminate things. But he didn't see it in that way. He thought this is the inner architecture of the universe. That he believes he's describing.
Hmm. So I suppose the question is, Ian, in terms of us therapists, what happens when we bring our beliefs into the therapy room? Because there's a whole cascade of things that might happen, and perhaps some of them positive, and perhaps some of them more challenging. And a lot of those are happening on an unconscious level, aren't they? I mean, I do. I certainly do that. It's no question. I think we all do. So,
I think we do. I think it's inevitable, isn't it, so John? I think the and I think it's problem. This is particularly problematic, I think, in the kind of in pre and perinatal area, where we're dealing with very experiences that are very primal and very powerful, but also very easy to influence because when somebody, whether it's working with it in a baby or working with it in an adult, you're working with these very global experiences that are easy to push in one direction or another. And I think so being aware of our assumptions here is really kind of quite important. And I think it's kind of interesting. If I think of Frank Lake's work, for example, Frank Lake doesn't really comment on this because Frank Lake's work is sort of outside this in a sense, really, because he doesn't His work doesn't have a reincarnation framework inside itself. So he's looking very much clinically at what happens when the soul comes into incarnation. Because the soul contracting and the idea of the is normally linked to the idea of cycles of reincarnation, which we may believe in or we may not. And it's also true to say that Groff didn't really kind of comment on this later. This comes in at a later point, I think, with some of the. So Groff, of course, talks about the soul incarnating. But unless I'm misremembering, I can't think of anything in Groff's writings where he talks about things like soul contracts or things of that kind of nature. That seems to be something that happens later on, I think.
And Jackie's asking, what are your thoughts on the tricky thing that is that for some of us who are very sensitive, that there is an innate knowing or felt sense that makes sense, which science has not yet caught up with?
Don't get me wrong about this. I'm not saying I don't know the answer to this, is what I'm saying, right? So I might have a sense of so I'm not saying it's not true or anything like that. In fact, part of what I am saying, I think, is particularly as practitioners, that we may believe something is true from our experience, but we may and certainly our own sense of it may be yes that this is true, but when we're dealing with somebody else's experience, it's really important that we understand that. I mean, it's very good to know our own view of it, but also it's also very good to lay that aside and to, in particular, not to interpret in terms of our belief structure. Now, that's a complicated thing to say because if you really feel it's true, you don't think it's a belief structure. You think it's true. And but I think one of the reasons why I think in healing work we're so often told to be careful about imposing our will and our structure on the other is that we can, even if in the end the other comes to the same belief as us, there's a real importance of letting people find their own way in their own healing journey. And their healing journey might include some very different views. I mean, if the person, for example, is a convinced Christian, the idea of soul contract is not going to make sense to them. They're more likely to relate to the will of God or something like that. So, I suppose the other is I do have a difficulty with it. I must come out of hiding a bit here and say I do have a bit of a difficulty with the idea. I'm not entirely neutral about this because my problem with it feels too deterministic to me. So it feels like okay, here's the plan. And so we enter into a play together that's already scripted, and I guess that's just not my experience of life. I think there's a lot of randomness. There's a lot of creativity in life. There's a lot. I mean, I do believe, I believe profoundly in the spiritual background of life. But I think but the other thing I think we have to look at, if we can look at this properly, is to look at what do we mean by the soul? Because the problem I have with some of the accounts of this, it's we're looking at it from the point of view of if from the person we are sitting here, right? So and I think it's inevitable that when we think of ourselves existing between lives, we think of a version of ourselves sitting in another place, having working out what we're going to do next then. Whereas the experience of the soul, at least my limited experience of the soul, is of this enormous multidimensional kind of presence that extends through space and time. And certainly I can really understand the possibility of it, souls collaborating together in a dance or like creating a symphony together or something. But the kind of linearity that you get with the soul contract idea. I'll talk a little bit more personally for a moment. One of my very early experiences in this work when I was doing it myself was of something like the first time I experienced really the sort of conception layer was just a sense of surging forward out of a space of light and life and mystery into something into something that I was attracted to, that was interesting to me. And I guess the field of my parents, or the and sort of landing in this, and then that experience being one of, oh my God, what have I done? I mean, but the problem with the way I'm describing this, right, is what I'm describing is a active memory from very early work. If I go back to if I come back to the actual experiences of something much more mysterious, of linearity emerging out of multiplicity and multidimensionality. So in some ways, these ideas, I think, for me, are helpful if they point us toward a mystery, but dangerous if they enclose us in a deterministic universe.
Yeah, I'd like to come in there actually, Ian, because yeah, I'm just thinking about how we get, it's a kind of seduction, isn't it? Well, I feel it is for me as a therapist. And I'm even sort of thinking from a therapeutic point of view, there's something incredibly attractive about having a framework
Oh, yeah.
to sort of rely upon or lean back into, to make sense of the shock that I may be feeling about meeting a 17-year-old boy who cannot speak and may never be able to speak.
Yeah, exactly so. Yeah.
And so, the dread in me about not having control or whatever the dreads are in me. Do you know?
Yeah, yeah. No, I think that's spot on, Sarah. I think that's exactly. So certainly, can think of many when I've worked with people with severe autism and just as you say, the shock of that and the sadness of that and the kind of and the need almost to have something that consoles or shapes that.
Yeah, I'm in a boat that's kind of all at sea.
Yeah,
And so,
yeah,
it's a sort of compassionate plea in a way to say that, okay, I really get why many therapists or people in all circumstances of life would, grab onto something to to help themselves in that time, thinking that they may be helping the family as well. But it is that big question about what does help.
yes, that's right. And surely, if somebody has that, our family had that belief, I wouldn't want to shake that belief for them. The thing of, but I just think things that the universe is much more mysterious than this. And so if I am able to be with the mystery of the autistic child who might never speak, instead of making it something they have chosen, as if it's, because it's, there's all kinds of reasons why that can have happened. I If I can be with that mystery and be with that sadness and be with that struggle, then I can much more likely enter into an intimate knowing of that person, so that we enter into a shared place of vulnerability together. I've never forgotten. Somebody else I worked with years ago, she was in a care home, and she had no language. She just said to in place to, and because of she really couldn't stand up even, and she was being looked after very well in the room. So he had him in this enormous beanbag. So you'd have to sit alongside her to talk with her. You would have to just be with all your own insecurities, your fear, your oh my God, I'm doing a bad job. Am I communicating properly here? And we're not communicating. Are we communicating? Am I doing any good? All of that stuff happens. But there were certain moments when all that would fall away, and there'd be a moment of contact, just a moment. And in a way, for me, those moments are reached, and not by holding belief, but by letting go of belief. And letting go of the desire to be effective, or the desire to do good, and then something else can happen. So I do, I guess, profoundly believe in the spiritual background to everything. But I think for me, at least, the idea of soul contracts, or choosing our parents, or choosing situations, that doesn't help me get to that moment, that deeper place. Because in a sense, the idea of co-creative fields where there's, in any true work of creation, there's randomness, there's unexpected possibilities, good or ill, really. And my problem, I suppose, with Steiner's ideas, which are the basis of all of this, is there's very little space inside him. This is how the way it is. Yeah, so I think that's for me, that's the nub of my problem with it.
Yeah, and I suppose also there's the whole issue of, advocacy if things go wrong at birth, that actually certain things, there are cases of malpractice, certain things need to change.
Yeah, totally. Yeah.
So, and also the whole aspect of kind of blame. I think it's possible that parents could easily feel blamed for saying, well, baby chose this, chose to have a C-section, or chose to be induced, and I think that's a very tricky area as well. Ian, could we touch on this notion, which kind of goes along with this territory, which is, and I don't know really where this came from, that, children came in to our family to be our teachers, so that our children are our teachers somehow. You hear this quite a lot. And can you talk a little bit about that, and maybe the potential issues with this notion?
Yeah. Unfortunately, this is another issue I have a problem with. So many problems. I'm a man with so many problems. Right.
It's important to talk about it, isn't it? It's very important.
It's very, very important.
Because otherwise, these are hidden assumptions.
These are really important. This is a very, very important issue, actually, because this sense of the sense of the reification, or the romanticism around childhood, where the children, as we know, are just amazing. They have these phenomenal imaginations. They're incredibly present, and they're children, and they have things they don't. There are things they don't understand. Now, one of the things, and this did come out again. This came out of the '60s, and the growth movements, and here the whole idea of the inner child plays a part, where the whole idea of healing was to get rid of head stuff, get rid of mental understanding, get in touch with emotion, and become as a little child. And people will still say today, but certainly said a lot in the '70s and early '80s, that you have to get rid of all this complication. You have to just be spontaneous as a child is spontaneous. Now, there's something about, somebody just said something very nice, actually. There's a difference between learning from our children and our children teaching us. That's great. Because there's something that we can absolutely learn about about the spontaneity, about the ability to embody the children have. But once we start setting up the child as teacher, and this is actually an idea that's got a very ancient root in Christian culture that takes us back to the Christ child teaching the elders of Israel in the temple. And so it's a very old kind of archetypal idea. And as an archetype, and as one of the Jungian archetypes, which is about the archetype of the child who brings newness and a new idea, it's fine. But once it gets reified into our children teaching us, we start to lose the sense of the children just allowed to be children, and adults being adults whose duty it is to protect and look after children, and at sometimes stop them from doing things that hurt themselves or and it's again, I think it's an idea that the distinction between learning from children, which is to really refresh ourselves in a sense of that kind of from their ability to enjoy life, to feel, and the sense of innocence and ability to fully embody is one thing, but the reification of the child has a lot of potential problems for me, I think. What do you think, John? What's your feeling on it?
I would agree with you, Ian. I think it is potentially problematic in terms of giving perhaps too much authority to a child, and therefore a lack of boundaries for them,
Yeah,
which
surely.
then perhaps doesn't create a sense of safety or containment. And I think it can easily get out of control. And that's kind of what I've seen. Yeah.
No, I absolutely have seen that, and I think it's a worry, really.
Yeah.
But if you kind of remove the reification aspect, and it's probably I think it's undeniable that a child will confront us in a way that we wouldn't be confronted by anybody else in our world. So, from that point of view, if we want to get the teaching from that, they will teach us. But yeah, I understand that the reification is an unfortunate aspect of that.
Yeah, it's not their function to teach us. Obviously, we learn a great deal, and certainly
Yeah.
having to, a child is angry with you or kind of battering at you, or you're trying to protect them or stop them doing something they want to do. There is enormous learning in that, and kind of, but it's not their job to do that.
Yes, it's different. Yeah.
That's a different thing, I think, really.
Yeah.
And how does Franklin used to talk a lot about the little one, didn't he? How does that play into what you're talking about, Ian?
It's that's another one of these interesting words about yes, Franklin Sills, who I trained with, used to use the word "the little one," which is a great word for helping you as an adult get in touch with that childhood part of yourself, and get in touch with the woundedness and the joy and the beauty of all that. And some of the ways in which, in fact, didn't really do this, but some of the ways in which some other people would interpret that is that they would make the little one as the core of their psyche. I was thinking of somebody I worked with once who, having got in touch, if you like, with the little one, decided that he was going to be called by his baby name and insisted everybody call him by his baby name, and his baby name was Little, whatever it was, and he insisted we call him Little. So and then then there is a danger of regression, of kind of instead of that small part, because in a sense the intention behind Franklin's idea of the little one is the welcoming in of that split part of ourselves, that split, the lost child in ourselves, we could say, into our hearts, so that all parts of us join together. And in a way, the method of co-process psychotherapy, in a sense, is to gather these things that Franklin Moore would have called the orphans of consciousness, places in ourselves that have become split off and exiled. And the little one being a prominent version of that, being gathered into the heart and included and and then integrated and let go of. The idea always was that the little one doesn't exist as the dominant force in our psyche, but being gathered into our psyche, being gathered into the wholeness, it just becomes integrated into our whole sense of who we are. And I think the problem always with a lot of these ideas is that they're double-edged. So in a culture that really is very cognitive and shut off from emotion, we need these ideas to help us get in touch with aspects that have become shunned or sent away. But the pendulum can swing in the other direction then, and that they become dominant ideas. So there's no mature consciousness that's holding and looking after those little parts.
Mm. Yeah, because as I'm hearing you speak about the little one, it's actually lovely to remember Franklin saying that and
Mm.
honoring him in this moment for sure.
Mm.
But I can also see how, in a way, some of this that we're speaking about is like us wriggling away from the reality that life is suffering. And I know that's a Buddhist concept, whether we don't have to buy that either if we don't want to. But the idea that there is something constant and fixed about life and that life should be rosy is something that perhaps,
Yeah,
as humans, we want it to be more joyful. We want the happy birthday. We want everything to be great.
yeah. I think that's right, sir. And I think it's the wish for the golden age never was, the happy
Mm.
childhood that maybe never was. These are understandable wishes, and of course they are. But the reality is that life is a very mixed experience of good experiences and painful experiences, and I think one of the problems really with the desire to hide inside the image of the child is it's ultimately a movement out of life. But taken another way, including that sense of child, the perceptions of the child, the spontaneity of the child, and the woundedness of the child, held in a different way, brings us right into the heart of life.
Mm. Hmm. And yet it's a big step to say that that child, decided to come in or decided its birth or decided these circumstances.
I think it is, and I think that the problem for me with that is that then because I think then we're up against when we're right into the origins of things, we're into mystery. We're into something that our mysterious origin. So when we do the pre and perinatal work, when we touch on the conception work, and then all the work that happens after that, we're into this extraordinary process of transformation. But there's a step beyond that, which if we look at before conception, my problem, so I don't have a problem with people having experiences of that, what that is. But in my sense, because that's the moment of the multidimensional entering into something that's more linear, our minds cannot encompass this. It's a bit like you and me talking about when we're encountering the young person with autism and instead of being able to enter into the painful kind of shock mystery of being with this person and just letting ourselves be impacted by that. That's, if you like, an analogy for the multidimensional experience. Whereas if we then have, oh well, this is their choice, we flatten it. And in the same way, I think that the story of I chose this sort of flattens that origin of mystery place somewhere, I think. But at least it does for me. Maybe it may not for somebody else.
Yeah, I mean, I've certainly been in quite uncomfortable situations in a teaching environment where, for example, I know that there are some students in the classroom who have children with Down syndrome or something like this, and a teacher has said, well, of course they chose this, and I always find that situation very excruciating to be in, because I kind of feel I need to say something, but actually don't know what to say. You know what I mean? And uh, it's, it can have. I think these kind of statements can have really. They can rupture a
Oh,
therapeutic
God.
relationship. They can rupture a teaching relationship. They can rupture the whole room because you could feel those ripples through the room.
Yeah,
You know
yeah,
what I mean?
totally. Yeah, no, I completely know what you mean. No, I think it's a very, very irresponsible to say stuff like that, to be honest. Because I think I think this is sort of in coming to the role of teacher and as well as therapist, really. I could wish we were more humble and could accept our limitations of not knowing and actually see not knowing as a positive thing rather than having to, because that very statement, they chose this. I mean, it's sort of a shocking statement, isn't it? I mean,
Yeah.
whereas actually, I don't, nobody knows why, it's a Down syndrome is a genetic process. It's a whole big process for the whole family. And to reduce that down into, oh, well, he or she chose that.
Yeah, and I feel, Ian, there's a very particular aspect of that, that, as you say, it puts a blanket on everything and it doesn't
Mm.
allow a variety of responses. Because, for example, the child that isn't verbal or whatever, the mother might be sitting there and saying, it's an amazing experience I'm having,
Quite exactly so.
and
Yeah.
I'm so grateful. Or,
Mm.
we have to create that space for any response, don't we?
I think we do, and I think that's the problem. And once we say things, global statements like that, we push the dialogue in a particular direction, and also we create a point. Well, as John was saying, the ripples go around them, and then you get polarization. People who think that's right, people who think that. So the sort of the mystery really of that mother and that child kind of gets lost really in that kind of discourse. Yeah, I think it's a great question, and it's of course a very difficult area. Um, now I always like the 18th century poet Coleridge, uh, who wrote very well about the imagination. He had this idea that the imagination as a human faculty had these three different kind of components, really. What he called primary imagination, he believed to be the process of perception itself. And what he meant by perception and he saw perception as being he called it the repetition within the finite mind of the human being of the creative intelligence that brings the world into being. He then went on to explore something called the secondary imagination, which is what Jung would have called active imagination, or J.R.R. Tolkien would have called subcreation, which is the sort of, if you like, the aligned reflex to that act of perception. But then there's a third aspect, which he would call fancy. Now, fancy, and it's interesting, he used the word fanciful, is the capacity of the mind to draw false associations and correlations between things, partly as a defensive practice. Very often it's linked to dissociation, it looks to surviving difficult things. So there's no one simple way, I think, to know that other than to know yourself and to connect imagination and perception to the field of the body. So this is why, I think a lot of the work, the important work that's gone on in pre and perinatal psychology has been very linked to the whole idea of embodiment. So that you reach the, if you like, the inner experience by and through a direct sense of the body. Now, when you're doing that work, and certainly therapeutically, when you're doing it, you're not querying that work. You're just doing it because if you start trying to query it at the same time as you're experiencing it, you just stop it from happening. But the main task as a therapist is to encourage somebody to follow the internal process, to keep in touch with their bodies, and to ensure that somebody doesn't get overwhelmed in the process of their inquiry. And then somebody comes out of that, and then they make sense of their inquiry. Now, this is where the whole thing I was talking about earlier about our beliefs and our views. People are very suggestible in that moment. So, as a therapist, you have to be very careful about what of your it normally is really important not to say very much at all about your belief as well about what has gone on. Rather, it's important to trust the emergent process and to trust the person's own meaning making out of that process, I think. And how you do it to yourself is you have to, it's that's why self-knowledge is really, that's why, you have to know yourself well and know the places when you're wanting things to be a different way. When Sarah and I were talking a moment ago about our distress of working with young people with severe autism, so that if you like, that the fanciful or defended part of my own mind can make a story about that to protect myself. Whereas if I lay down that story, it can be alongside the pain and the difficulty and the distress and allow the impact. Then something else becomes possible.
Okay, so well, we've got to wrap up in a sec, Ian. So some maybe closing thoughts about where where we've landed with all this, if there are any, if you want to
Well,
add
I
us
think
some up.
I think what Brady has just said is actually kind of quite important, really, because I think
Mm,
there's something about because I think what we're looking at, and what I suppose what I'm interested in here is deconstructing these ideas as a dogma, but the sense of our lives having intrinsic meaning, and the sense of I mean, I equally came from quite a difficult background, really, and which prepared me for many of the things I was later going to go on to do. So I think there is for me, I think the idea that there is a sense of meaning and purpose and mystery and what Jung would have called synchronicity, that rings true for me. But it's when these ideas become dogmatic. It's a bit like Franklin's idea of the little one. Hold it one way, it's really liberating. Hold it another way, it traps you in a small and regressed portion of yourself. And I think that's kind of the important thing here, really. It's like holding the ideas lightly, but letting the ideas feed our ongoing sense of the unfolding mystery, I think. And therefore, what any idea that helps us deepen into that sense of the mystery of life, the vulnerability of life, the joy and the sorrow of life is helpful. But an idea held one way will do that. Held another way kind of closes down and causes us to step out of that central place. At least that's what I often experience, really. Yeah, so I think that's what I feel in summary, John, really.
wonderful.
Well,
Thank you. I mean, so many of us, I certainly have this feeling of, of purpose in life, being here to, you know what I mean? And I always
hmm,
often get a sense. I know children have this sense, don't they, of
yeah,
coming in from somewhere and when we die, going somewhere else, and this having a purpose to it, which I think is very very beautiful actually, and it's very empowering as well. And we can layer all kinds of other beliefs on top of that, can't we? So
I think so, yeah. I think that's the danger.
very good. Well, thank you, everybody. Thank you, Ian. Thank you, Sarah.
Pleasure.